Who am I? That's a good question. Who am I today? So
Exactly.
I'm Cathy Holloway. I have a couple of hats. I'm a professor of something called interaction design and innovation, so how we interact with technology and developing technologies, specialising in the development of technologies that aid disabled people generally. And I'm also a co-founder of a small startup called the Global Disability Innovation Hub.
I have an architectural design firm in the States, and we specialize with people with disabilities. I've been in the field since 1982, working in this area, and we see a variety of individuals and provide design and mobility services for people to make their homes accessible. It's a challenge every day, which just makes it interesting for us because you're problem solving with these folks. And our age groups range from 2 or 3 months old all the way up to, we just designed out something for someone who was 96 years old. And they're all wanting to live home, either with their families or on their own. And our firm is involved with trying to provide those services for people. And we work with a variety of people from the Department of Health in New York to managed care services, basically large insurance companies who are willing to fund some of these renovations. And it's actually busier than it's ever been. And I've been doing this for quite a long time.
Yeah, my name's Dan Eades. I'm the CTO of My Global Home. My background is in the residential construction industry for the last 20 years, where I've been deploying technology, unfortunately, mostly in meaningless applications, I'd say, for very rich, wealthy people, and cinemas and lighting control systems that make their lives more enjoyable. But I was approached by My Global Home to become CTO and given the opportunity to deliver real meaning behind technological installations in people's houses. So a lot of what we've heard about today, data collection, technology, control systems, things actually, automated processes, interoperability. Our company is all about focusing on the business model that can deliver that effectively and efficiently into the residential sector, not just for the super prime market that I've been involved in my career, but for everybody, from the least expensive house to the most expensive house or hotel room in the world. So democratization is where we're at.
Hi everybody. Yes, I work for an organization called AAS Bologna, and where we have a center which is called the We Care More Center, where more stands for the intelligent use of technology in integrated care. So we are very close to end users. We develop several projects, and where we try to introduce technology into care processes or in processes supporting people's independence. And on top of that, I'm here on the program, I think also as representative of the Global Alliance of Assistive Technology Organizations, CATO. I'm also part of the SHAPES project. And in that capacity, we are doing part of the pilots in Italy, in the center where I work, which is the We Care More Center, as mentioned. What is important is for us is that we, when thinking about how technology can support independent living and integrated living in the community, we apply a biopsychosocial tech model of human functioning. And that's actually quite interesting, because we all are aware probably about the biopsychosocial model of human functioning. But technology is increasingly part of the way we function, the way we do our activities, the way we, let's say, communicate or participate actively in the community. So what is important is to understand is that if you want to optimize the functioning for activities and participation of people, we need to identify different areas of need, but also different areas of empowerment. And that is what we do in the We Care More Center for Research and Innovation. Next. Okay. I brought a couple of examples here of how technology can actually support the independence of people with disabilities. And the first one is interesting, as Carla. She lives with a lifelong disabling condition. She is in residential care, but the great thing is that she supports her parents remotely. So it's a sort of a turn of the concept. Until a couple of years ago, her parents were looking after Carla. And nowadays, Carla, thanks to technology, is able to look after them. Then we support Annunziata. Annunziata is an older lady. She's 89 years old, and she has quite some health issues, but she still lives independently. And thanks to a smartwatch with app who measures her well-being, and thanks to Alexa, which is a very mainstream technology, she actually connects with her family. Valentina lives with a lifelong disabling condition, and she was supported in making her house completely accessible, but not only, also smart, so the house communicates. She works from home, and thanks to the technology that was applied in this situation, her care needs were reduced from 12 hours a day to 3. So those are examples of how technology can actually empower people and also make them more independent, more integrated in the community. So what are requirements for enabling homes? Well, dwellings should be accessible, customizable, manageable, livable, sustainable, safe, enabling activity and participation. And nowadays, it's possible to transform houses into active agents that can actually guarantee quality of life of people in very different conditions. So the real issue is not so much the technology, but how to co-design solutions by matching the person, the technology, and the environment. Now, there are a lot of strategies that can be used to do that. You can start from scratch by universally design prototypes or environments, barrier-free building. You can adapt the environment. You can use smart technologies. You can use assistive technologies. You can use remote support services and person-centered digital health solutions for integrated care. And that across the wide range of spectrum. And I just gave you a couple of examples of that, whether it's in residential care, in co-housing, in assisted living, or in smart homes for independent living. So the challenges for neighborhoods that care are to create the conditions that actually cost-effective and rational public expenditure supports the quality of life of people with dependency needs in the community is in place. But also that integrated systems for welfare provision are created, in which public and private actors collaborate, supporting individuals, especially in crucial life areas. And finally, to consider the role of person-centered technology. We use the word person-centered technology to highlight that the person is always in the center, to boost their independence and to support integrated care in line with international frameworks. For time reason, I'll go quickly over this. There are relevant policy frameworks for inclusive societies, as you all know. The UN Convention was already mentioned. That is absolutely relevant because it talks about equal opportunities for people and how technology is a human rights enabler. Then the Sustainable Development Goals, of course, and the Gates Initiative of the World Health Organization. I don't know whether it has already been mentioned, but the World Health Organization is increasingly looking into how assistive technology, and it started with low tech, but is slowly moving into high tech as well, is actually creating the conditions for people with disabilities and also older people to be active part of the society and of the community. So what is my key message of today? That is that we probably at community level or city level, we need independent resource centers, because that exercise of matching person and technology and participation in the community is a complex process. And different factors have to be assessed health-related factors, social factors, community participation-related factors, the built environment, the opportunities provided by technology, and education. So having those kind of resource centers close to the community or in the community becomes a fundamental requirement to be able to create fully inclusive communities where everybody can participate in equal terms. There are examples of this kind of centers. For example, the independent AT centers network that we have in Italy. They are the interface between what is available on the market and what are the users' needs. They work with multidisciplinary teams to look into the different issues and to co-design together with the users solutions that allow them to be fully included in the community. They provide independent advice, personalization and training of equipment, and help in this way funding agencies to spend their money better. Talking about GATO, it was already mentioned that Global Alliance of Assistive Technology Organizations that I have the privilege to lead as Secretary General. We are very much intrigued by what's going on in this let's say community. Let me call it like this. And what we see as a relevant recommendation is that we align with global human rights standards in the whole process of building, let's say, inclusive neighborhoods, that we invest in enabling infrastructure, that we consider the enabling role of technology, both at personal and at community level, that we guarantee professional support at all levels, and that we take cultural differences in account. It has already been mentioned. But there are very significant differences between cultures on how community participation is being perceived. And we should foresee mechanisms to measure participation and quality of life. GATO, speaking about GATO, and on behalf of GATO, I think we're ready to support this process. Thank you.
I was just sitting there thinking about communities that care, and two reflections came to my head. The first was the two communities that I've recently been in over the last few years since we set up the Global Disability Innovation Hub, where I have felt there was most caring. One was in the Cockle Bay community in Sierra Leone, which is an informal settlement or a slum. And the second was Kibera in Kenya, which again is an informal settlement or a slum. And in both of those places, the disabled people were helped not by any technology, because there wasn't any, but by other people. Like the children would help blind people get around, people would help people. And I often feel when I'm in those places, and then I come back to London, that there's this dichotomy of progress, if that makes sense. And the second reflection is I grew up in nursing homes. My parents had nursing homes. One for very wealthy people that could afford private rooms, which had 12 or 14 beds, and I used to cycle there after school and meet people who had survived the Holocaust and things. And then the second one was for more working class people. One was in Chichester, one was in Bognor Regis. If you know West Sussex, you can figure out which was which. And I, as a kid, used to ask myself two questions. One, why are these people here? Especially if they only had a stroke, why are they here? I don't understand. And secondly, why do the people in the one where the people who are poor all sit together, and the people who are rich all stay in their own rooms, generally being really miserable, right? And I could never understand that as a child. So I was just sitting there thinking, when we think about care, that's what we think about. Anyway, that's why I care about global disability innovation, as partly because of my background in growing up around nursing homes, like growing up around people who maybe couldn't help themselves, and trying to figure out why as a society we couldn't do a better job. I was really lucky. In 2012 we had the Olympics here in London. That was wonderful. You can see it was the most accessible Olympic Games ever. The first time the Paralympics was sold out, stadiums were full, history was made, people felt proud to be British and also to live in London, right? And people spoke to each other. It was amazing. And I was lucky enough to be introduced to Victoria Austin and Ian McKinnon. Ian did all the inclusive design work on the built environment, on the Olympic Park and the Paralympic legacy program, including intergenerational homes, including transforming the stadium, including UCL's, University College London, my employer's new building on the Queen Elizabeth Olympic Park. He also ran the Built Environment Access Panel for the standards for how we get buildings approved. So a group of disabled people could veto the right of a building. They could say, well, no, you're not allowed. So the rights were built into the planning process. And Victoria Austin, who led the Paralympic Legacy Programme. And we managed to get £10,000 off of UCL, matched that from Mayor's money of £10,000. We brought these founding partners together and said, shall we try and do something a bit differently around disability? I was sick and tired of this dichotomy between aging. I know we're not allowed to say aging anymore, but let's just intergenerational. But anyway, aging world, people who are older don't want to be called disabled. Disabled people desperately want to hold on to their identity as a disabled person, but yet that doesn't help with market dynamics. It also doesn't help that transport people think health people should fix the problems, transport people should fix the problems, and then somebody else thinks technologists should fix the problems. So I thought, well, why can't we all work together? And so, there we go. So we set up GDI Hub. Said it was 20 grand. Apparently our portfolio is now 56 million. We work in 36 countries. We have helped deliver the global report and some other things, but we're trying to help these 2.5 billion people. And we're a relatively small team, so we try and pick off the bits, which I call like the meso layer, like help the really good ideas that are on the ground better connect to the systems infrastructure, whether that be at a city level, whether it be a company level, whether it be at the UN level. So, there we are. We launched the Global Report on Assistive Technology that Evert would know very well, and that's Chapal, whose brainchild it is. And in fairness to Chapal, the guy in the middle, for those of you who may not be able to see, he has led this movement within the World Health Organization to put assistive technology on the map, which it wasn't to begin with. It was like, well, why aren't you doing rehab? Or there was aging, but the actual technology bit wasn't there. And he spent his life doing that. And the Global Report was a massive breakthrough. And we are the collaborating center, hence helping to launch this. So at UCL, I run the World Health Organization's collaborating center on assistive technology. So getting to standards, which I was asked to speak about very quickly. Within GDI Hub, we've done the inclusive design standards for the Olympic Park. They're now being upgraded to be global, which will include things like in Mongolia, trying to look for standards for when you're trying to rehouse people who are normally transitional, like they normally move around the world, as well as slums, as well as cities like New York, like London. The Global Report on Assistive Technology contains standardized data sets. So we didn't have any data on the numbers. It was this 10% figure. 90% of people don't have access to assistive technology, but where are they? Which assistive technologies? Is it glasses? Is it wheelchairs? Is it prosthetics? Is it hearing aids? If you've got to make a really difficult budget call between funding education or funding healthcare, and then within healthcare, funding assistive technology, you need to know exactly where the numbers are. We helped and we funded the World Health Organization and UNICEF to do assistive product specifications in order to put them out for procurement. So UNICEF is one of the biggest providers of assistive technology globally, so trying to do that, and that's another data tool. So within the Tidal network, we had done all this stuff globally. We'd got a massive grant, we did it globally, grant got funded, refunded. And then eventually we thought, we need to come back to London. So with Tidal, that's what we're doing. Our purpose is to improve the quality of assistive living technologies and hence lives of people who use them. And ultimately try and get over what we call the TRL level 5 trap. Especially in the UK, we're finding tons and tons of research where technology is very well designed with end users, with systems providers, but it can't get over the funding hurdles of TRL level 5. So we end up not seeing it funded in that middle gap to get the evidence required for venture capitalists or others being backed. I'm hoping that if we work a bit more together, we can do that. We can work in Dan's testbed, or we can work across Europe instead, and obviously we can work with the ISO standards. So one of our challenges at the moment is how can standardization be used as a tool to accelerate disability innovation and innovation that supports healthy and happy aging, because I'd like that. And so together we hope to change the world, and we back the ISO 25553 multi-generational neighborhoods that care.
Good afternoon. So, Mark, what we've been trying to do for the many, many years, besides trying to provide access for individuals who want to remain in their homes and function in their homes, is we work with different groups of individuals who are looking to provide adaptable and usable spaces in their homes that would be provided. So there are a lot of individuals. One is Louis Tenenbaum. He's out of the States. He has a company called Homes Renewed, and he's trying, as well as Jane Bringoff of Bringoff, Center for Universal Design in Australia. We've consulted to both of them, and they're trying to standardize the industry, the construction industry. So when they build these projects where you have multiple units in a prefabricated design, that they would be able to be made, where they could be modified. They could be used now, and then later on, without much retrofit, they could be adaptable. So if the person living in this facility or living in their condominium becomes disabled, they would be able to easily renovate them and make them more functional. But unfortunately, that's not always the case. And a lot of the companies who are building these 300, 400 unit condominiums are not really willing to make those adaptable changes and put it into the expense of renovating a new complex. And although there are it's the National Association of Remodeling, they're trying to provide these types of codes that would be written into the construction codes for new construction projects. And that is coming along. I mean, this has been a long process. This has been suggested and in conversation through my life since the early 90s, after all these different new codes were passed into being. But again, it takes a long time for people to see things that are different. And now there's such a large amount of individuals who are older who need these renovations. So maybe now that that's happening, that they'll provide these accessibility designs for future homes. But in the interim, what we do as a company is we work with a lot of different organizations and are funded to renovate or at least design out homes for people who want to stay in their homes. And we're seeing a tremendous population of people my age. I'll be 70 in 2 months, and younger and older who really don't want to move into condos, want to stay in their own homes, like I would like to stay here, and make these accessibility changes as required so you can function in them. And that's the bigger issue, because most of the problems that we're running into is retrofitting and making a space functional and accessible depending on the individual's disability. So, we have individuals who are just more or less using a walker and ambulating pretty well and are healthy otherwise, and the modifications could be minimal. But then you have a lot of individuals who are in chairs, wheelchairs, or mobility devices like scooters. And these folks need much more extensive renovations if they want to be able to stay in their homes and be comfortable within their own homes. Sorry. So this is where we're trying to provide these services for these folks, and are on call to do this for them, because there are so many individuals who want to remain in their homes. And we do also see a large group section of children with disabilities. Years ago, when I first got in the field in the mid-'80s, they would most of these folks were institutionalized and put into facilities where they were cared for, like a nursing home for a child. And then the changes in the codes from the Department of Health and around the states, the United States, they allowed for home renovations for children with disabilities so their families can maintain their health at home. But again, what we're seeing every day is, depending on the health of the child, they're getting generators. Our firm's designed about 60 in the last 2 years for family members in the New York area. And then there's bathroom renovations to make them accessible, and entries to the house because they're not set up structurally to allow for a wheelchair. So there's extensive renovations, and a lot of these things are running in total costs of under $100,000, but you're getting up there to $60,000, $70,000 per home for someone with extensive disabilities. And it's not going to stay this way. Somehow, the funding either is going to wind up being changed, and that's going to we're going to revert back to an older way of looking at it, or they're going to keep funding these things through Medicaid or through health organizations. A lot of the managed care companies we work with, you have all types of agencies that do this, and Fidelis Care, you have Home and Health Care, you have all these different medical companies, Blue Cross Blue Shield. They really have programs for children as well as for seniors. And these persons they're paying for the renovations of these homes because they see as cost effectiveness that keep them home is cheaper than institutionalizing them into a facility. So you have a lot of different things here, different perspectives of care, from individuals who have the resources to renovate their homes without issue, to construction firms who are building these facilities. And hopefully we'll all be able to come to a happy medium where we could live comfortably into our old age. Thank you very much.
Thank you very much, Todd. I think we've kind of hit the nail on the head to some degree, because we're talking about cost effectiveness, or who's going to pay the piper. And in that regard, I think Dan is a perfect person to speak next, because his business came out of grant funding and is still receiving, I believe, some Innovate UK.
In 1 week.
Okay.
Yeah, on Friday, finishes on.
Innovate UK, but equally, they are a commercial concern, so they have this balance they have to strike. So it's a good cue for you, Dan.
Thanks, Ian. So yeah, as I mentioned earlier, I'm Dan Eades. I'm CTO of My Global Home. As Ian alluded to, we are an organisation that's been funded by the Industrial Strategy Challenge Fund through Innovate UK for the last 2 years. It's been a great run and has allowed us to do a great deal of collaborative work with some really great collaborative partners. But we're now coming to the end of that, and we're beginning our journey into commercialisation, which I'm very pleased to say is going well so far. So this is a quote we often start presentations with. It's from our CEO, Lee. My Global Home is founded on the principle that in the near future, our homes will look after us rather than the other way around. So by that, we mean that it has inherent infrastructure and technology built into the home that allows the home to perform certain functions, to monitor, to optimize, and to feed back to relevant parties information about how we're living and how we can optimize our lives from multiple different perspectives. And we come at this from an angle of stimulating the real estate construction industry to actually have the business model to justify building homes with technology built into them from the start. Too often, if any of you have been involved in the real estate industry, it's a very messy, very dirty, very costly, very complex industry. And often technology just gets left out of the equation. It's value engineered out. It's seen as a problem. It's seen as one more trade, one more issue for the construction industry to deal with. That can be in new build properties as well as refurbishment and retrofit projects. It's with the proliferation of IoT devices on the market, it's often seen as something that can be added later, a smart veneer that can be added. But as we all know, we've all had experience with those devices, it's very fragmented. It takes a lot of time to set them up, and it can be a real problem to get it working properly. So our focus over the last 2 years with Innovate UK has been to find a business model that allows us to deliver that effectively into the industry. So that has led us on to actually thinking about how we stimulate the building of a network of homes that can all interoperate with each other. So we see each individual home as the centre of an intelligent community, and each intelligent community as the centre of intelligent cities or rural communities. We see each of those as part of an intelligent national network, and then the national network as part of a global infrastructure. And the way that we are stimulating the adoption of our technology into the market is by looking at actually the top of the tree. the people who actually put the money into these developments, whether that be local authorities or housing associations, or whether that be private wealth or private investors into building developments. And we actually look at their problems and we say, if we can solve the problems at the top and actually stimulate them to put more money into buildings, then we can actually stimulate growth on a large scale. So that could involve helping financial institutions understand how to put green capital into buildings, how to stimulate green lending, how to stimulate green bonds, how to stimulate green mortgages. Or that could be looking at asset management for housing associations, or it could be looking at increased healthcare outcomes for developments where that's more relevant. But for us, it's all about building an intelligent network. And once we've built that network, which we're in the process of doing, we've got a pilot network of 150 homes that's already been built. We can actually learn from the insights that are fed back from that network. And we can learn contextually within climate, demographic, social, governmental, global, cultural diversity. We can actually learn how homes perform in each of those different locations. And for us, it's not about becoming an expert in all of these fields. We're not experts in all these fields. I'm not an expert in agile aging. I'm not an expert in sustainability per se. But what we are experts is in his technology and actually delivering a technology solution which will be baked into all of the homes that are built. And for us, it's not about IoT. It's not about cloud to cloud. It's not about data sharing. It's about edge-based technology, which is robust, accurate, repeatable, built into every home that's built to then form part of a network that can all learn, so we can all learn from each other. Happily, by doing that, by stimulating the top of the tree to invest money into these projects, we actually deliver real meaning for occupants at the same time. So whilst occupants are actually the front and centre of where we started this project, we realised that in order to give access to this technology to them in a meaningful way, we had to start at the top. So right at the sharp end where the homes are built and the homes are occupied, we're delivering meaning in terms of healthcare, sustainability and in cost of living. So in healthcare, we're working with a company in Italy to look at how we can look at contextual data within the home. So how does the actual environment affect your healthcare journey? We spend 65% of our time at home, roughly. So how does the environment in terms of air quality, in terms of humidity, temperature, pressure, movement, behavioural patterns, how does that affect our healthcare journey? How we can use technology to optimise that. Sustainability, we're looking at very granular information about how energy is consumed within the home and providing information back to homeowners about how they can optimise their sustainability, but also putting the home into automatic mode to allow the home to take care of its own electrical consumption and actually really drive towards carbon positive homes rather than just carbon net zero. That obviously has a knock-on impact on the cost of living, but we're also looking at predictive maintenance analytics, which allows you to engage with the maintenance community without having to just ask someone to come around and spend a fortune trying to fix something where the problem didn't exist in the first place. So that's a very brief introduction to My Global Home. I didn't have a timer, so I'm not sure if I've gone over 5 minutes or not.
You would be within the timer, and you were right.
Okay, great. So just to end on the same quote, My Global Home is founded on the principle that in the near future, our homes will look after us rather than the other way around. We believe we're delivering a business model into the industry that allows that to happen in reality, allows lots of the things that have been spoken about today to actually come into fruition in real homes and real environments. And I'd open invitation for anyone who has an application, a technology, a use case, a disabled technology, a healthcare application, an agile aging application, a sustainability application, an energy optimization application to get in touch with us. We have an innovation centre on the University of Surrey campus in Guildford, which was built with Innovate UK money, and we welcome people to come and collaborate with us. Thank you.
Excellent. I think that's a nice broad canvas in terms of looking at the assistive living space in a relatively short period of time. We are running late, so we will take just one question.
You showed the slides with I think the third woman, you said with the technology, you reduced the time from 12 hours to 3 hours a day with the help of technology for taking care for her. So what happens if this person has to go to hospital? Can she take all her technology with her, or is it completely different at hospital? So as a general question, what happens if you are at home, very well equipped, but then when you have to leave your usual home?
No, that's a very good question. As a matter of fact, a lot of this technology is installed, is embedded in the environment. So that's very difficult to take that away. We talk about houses or homes that are actually made on tailor-made, suited on the needs of the person, the individual living there. So that is a major issue. When I was speaking about the reduction of the care needs, that means that she is now able to stay alone in her home to earn her living by working. She fully controls the environment, also who comes in, and so she has control over everything basically. And the only care needs that remain are actually to be supported in dressing and getting up. But of course, it's homebound. Part of it can be taken with you in the community, but most of it is actually installed in the environment.
Yeah. And the standard would help that.
Sorry?
A standard would help that.
Yeah.
That's what she said.
Yeah.
Yes. So more generally speaking, for all presentations. So if it's easier to move from one place to another for an accident or something like this.
Yes, of course. And it's also interesting to note that more and more of this is also wearable or becomes, let's say, so it does not necessarily have to be part of the built environment, but can also be moved. A lot of sensor technology is increasingly mobile.